Okay, we're to the lightning round, and I thought this was a typo at the beginning when I saw this. These folks have 1 minute to deliver content. All right, stretch it out, Kristin. Kristin Whitney, sports medicine physician and instructor of orthopedics at Harvard Medical School, a member of the female athlete team, as we just heard from Kate, and we're going to dive into your work in the Boston Marathon.
Great, thank you so much. So as Dr. Ackerman mentioned, our group recently had the opportunity to study prospectively human performance and medical outcomes among athletes registered for the Boston Marathon, and look at particularly at the effect of problematic low energy availability indicators on performance and health outcomes at the event. So we partnered with the Boston Athletic Association to recruit 1,030 Boston Marathon registered athletes pre-race, altogether including 546 females and 484 males. They completed a pre-race survey before the event that included validated indicators for problematic low EA, and then we linked to race day outcomes using their wearable timing chips and using a novel web-based medical tracking system that we had available at all 30 of the course medical tents. We found that, first of all, problematic low EA indicators are very common in this population, so over 42% of females had indicators of problematic low EA and over 17% of males, and we found that it substantially impacted their athletic performance. So in their age and sex matched division place ranking groups, the individuals with problematic low EA indicators had poorer division place rankings compared to their healthy counterparts. We also saw that they had substantially increased medical risk. So they were twice as likely to show up at any medical tent having to stop for medical support for any reason, and 3.6 times as likely to experience a serious medical event, meaning did not finish because of a medical complication, critical condition, or needing to be transported to a local hospital. So this is a first large prospective study to demonstrate the adverse human performance and medical outcomes linked to problematic low EA at a specific real-world competition event, and translated and applied to the athlete. Thank you.
All right, I think Kristin did it. Thank you, Kristin. One more lightning talk. This will come from Laura von Rosmalen. She's a Wu-Tsai Alliance postdoctoral fellow at the Salk Institute, and she's going to show us a mouse model, for relative energy deficiency in sports.
Thank you. So we are interested to better understand the underlying mechanisms of relative energy deficiency in sports. We know that RED-S is a very complex disease that involves many different organs. So we are many different organs that are hard to reach in human patients. So that's why we develop a mouse model to study RED-S. So we can make our mice exercise a lot. They run up to 15 kilometers a day. They eat less, and therefore they are on a negative energy balance, so they lose weight. So if you would like to know if our mice show more similarities to RED-S patients, or if you would like to discuss with me whether we can use mice as a model to study RED-S, please come by my poster 33 over lunch, right there in the corner. Thank you very much.